My name is Dr. Tony CERE, physical therapist, co-owner with my wife, Melissa CERE.
I'm Dr. Melissa CERE, and my husband and I are the co-owners of Kinetics Physical Therapy.
I went to PT school at Florida A&M, graduated in 2000, and then enrolled in a transitional doctor of physical therapy program with the University of St. Augustine.
My initial interest in becoming a physical therapist actually started back when I was in high school, watching my sister go through months and months of rehab after a series of neurosurgeries when she was 10 years old. That's what really triggered my interest in the profession, and I had never really thought about owning my own practice too much until Tony and I met.
I always knew that I wanted to have my own business, so we went through the whole process of business plan, reaching out to people that we knew, the private practice section of the APTA, and it's a lot of work. You're in it, you're doing it, we loved it, and over time we've been able to grow the business, add people to our team that can help us continue to grow.
For me individually, I think the draw was more so having some flexibility. It was beautiful for me to be able to kind of seamlessly grow still professionally, even while we were also growing our family and having kids. At Kinetics, we offer musculoskeletal ultrasound. We also offer electromyography, the EMG, and we also perform nerve conduction studies as well for our patients.
Having the additional diagnostic testing, the ultrasound, the EMG, and nerve conduction study, we're able to more specifically, pinpoint what's going on, and it helps us to be more of that primary care point of entry into the medical system in the Gainesville area. Over the years, we've seen lower and lower reimbursements. We've constantly looked at, what are ways that we can work on improving our profit margins. There's things that we've done as far as adding cash-based services. And diagnostics was also part of that. Hey, we can get reimbursed at a higher rate with performing these tests, and it helps our patients. It's like a no-brainer. Let's do this.
We want to be the top of the list that patients choose from whenever they're coming to PT. We don't want them to settle for coming to Kinetics for PT. We want them to seek us out. And providing the diagnostic testing, that allows us to have an extra bump over the other providers they could choose from in town because of the level of care that they're getting here.
The folks that are part of HODS, they're wanting to be on that cutting edge, and they've got great ideas. And it's really cool to be able to work with folks who have already gone down that road and tried different things, and hey, this worked, this didn't work, and try this, so that has been huge for us. Being able to help people and doing it naturally without continued medications, injections, avoiding surgery if needed, just helping them recover and rehab and get back to function, because when people come in and they're in pain, they're not able to do things they want to do. Kind of being a part of that process and seeing that process early on, I was like, wow, you're able to have that big of an impact on people's lives, and that's what kind of drew me into that direction.